All right, so we're here at the doctor's office, and to make life easier, I'm wearing shorts. Yeah, wearing shorts in February. But here's what we got. We got this knee right here, which is pretty ugly. Doctor's gonna put a needle right in here, right about there, and put this gel in there to try and help it, because literally I have no ACL in this knee. And the outer orbit of the bones right here literally are rubbing a groove in each other. And the reason why is because of this knee. This knee, which was actually burned after I had the flesh-eating bacteria. This knee had 3 knee operations in there, and they literally scraped the bone. So I started leaning on the other knee, which made that knee worse. This one is less worse, but this one's awful. So the injections are to help me try to see if I can make it to 60 before I get a knee joint replacement, because he's worried about me wearing it out. And see, this is one of those things that you look at it with NFL players. Their quality of life after football, for a lot of them, is not real good. And when you start thinking about having to have insurance and being taken care of and things, it's kind of like being in the military. You know, they have, the VA, so that way you've got your medical and stuff taken care of. There are no benefits after you finish playing football, and I know they make a whole lot of money and stuff, but when you start thinking about a lifetime of pain and agony and work being done, I don't know if there's enough money out there for that. So we'll go ahead and take a look and show you, give you a taste, just a little taste of what I have to deal with. And I didn't play football for, say, 10 or 12 years in the NFL, so I can imagine what they're dealing with. Okay, so I'm sitting here on the table, and this is the worst part. It's like waiting for the doctor to come in and stick you with the needle. So they spray it first with something that's kind of like cold to help numb it a little bit. Oh, man. Wish you guys could actually, I don't know if you can hear this. I don't know if you could hear that cracking that's going on in my knee. So they freeze it first, and then they stick the needle in there, and he gets it in there nice and deep. So a lot of people say, when I tell them that I don't have an ACL in that knee, they're like, you can't make it without an ACL. Well, we're going to ask the doctor if I'm a liar or not. We'll ask Dr. Thompson, and he's been taking care of my knee for about the last... I'm finally here with my buddy, Dr. Thompson, who's been taking care of my knee and keeping me walking for the last 7 years. And it's always funny because every time I come in here, he's like, I can't believe you actually walked in here on that thing. So, Dr. Thompson, can you just, people don't believe that I don't have an ACL in this knee. And they say, you can't be walking around with an ACL.
Absolutely. Yeah, common. Happens quite a bit with a lot of injuries, and people just live without an ACL.
Right.
But they always get arthritis. Yeah,
and that's where I am. I've got arthritis really bad. One question for you is, NFL players, let's say you played for about 10 years and had a couple of knee injuries. Is this kind of common what an NFL player would end up having to deal with?
Yeah, there's a lot of wear and tear, like MCL injuries. There's a lot of injuries that happen that don't necessarily need surgery, but then have consequences later.
And the arthritis is
arthritis, especially even if you have an ACL injury that's treated with surgery, you often get arthritis after that later.
Yeah, Todd Gurley's actually dealing with arthritis already, and he's still like 28, 29.
Yeah.
So, yeah, it's no joke. And this is the reason why I think NFL players, when the owners are putting out, oh, we'll take care of you 5 years, this is a lifetime worth of injury and problems you're going to have. So he's trying to help me make it to 60 because I'll wear out a knee joint replacement.
Yeah, you're just too young. You burn through it in a decade or less, I'm sure.
Yeah,
it'd be nice to have it last longer though when you can do it.
Okay, I got to get my shot now.
There we go.
When basically whenever I go through and sit in my truck for more than like 20 minutes or so, those first few steps are just like literally a nightmare.
I know,
or even
it's like an old person thing.
But as long as I'm walking and moving around, it doesn't bother me so much. But once I stop, it's just bad.
Yeah, you can. I've preached exercise so many times. Like, you find, like, if you keep it moving, it's okay. It's not terrible.
And so is this the synthetic one, or is this the chicken cone?
Yeah, this is synthetic, all synthetic. So. has less allergic reaction than the rooster cone.
Okay.
Loving it.
All right. Hopefully this will be better than the first one.
Yeah, we're out of SpongeBob Band-Aids too.
Oh,
sorry.
darn. Okay. All right. See you next week.
That seems a little more for me. Yeah, we got it.
When basically whenever I go through and sit in my truck for more than like 20 minutes or so, those first few steps are just like literally a nightmare.
I know,
or even
it's like an old person thing.
But you know, as long as I'm walking and moving around, it doesn't bother me so much. But once I stop, it's just bad.
Yeah, you can. I've preached exercise so many times. Like, you find, like, if you keep it moving, it's okay. It's not terrible.
And so is this the synthetic one or is this the chicken cone?
Yeah, this is synthetic, all synthetic. So has less allergic reaction than the rooster cone.
Okay.
Loving it.
All right. Hopefully this will be better than the first one.
Yeah, we're out of SpongeBob Band-Aids too.
Oh,
sorry.
darn. Okay. All right. See you next week. Okay, so that's it. I got to make it out to the car. Oh, or truck, I should say. That's smart. So this gel gets in there. It's real thick. And it just basically tries to make up for the lack of ACL and meniscus and cartilage in there to help cushion it. And this is basically a stopgap, measure for my knee. Fortunately, the only other thing they can do is a knee joint replacement. And the problem with this is like you said, if you get it too young, you can wear it out, and you can only get it done twice. So at 54, the way I move and do everything that I do, if I got it done now, I'd be 64 and possibly then wear it out again and be in a wheelchair. So best thing to do is suffer right now as much as I can, and then hopefully in my golden years be able to move a little bit better. So let's get out of here. Oh, Lordy. All right, so final thoughts. We don't think of NFL players as people and realize that they get hurt. They have damage, and you're talking about a lifetime full of pain and work in some cases, and quality of life. And sometimes people play way too long and they really are messed up. We don't see that because all we see is Sunday them on the field and don't realize what they're doing to try and stay on the field. Sometimes these guys are going into the locker room and getting, injections to numb the pain just so they can get back out on the field while they literally tear their body apart. And you will pay for that at some point. And maybe the NFL should help pay for that as well and feel some of that pain. I'm Mark Holmes, and as always, thank you guys for being part of the Jobu Sports Report. I'll see you